everyone. This is Dr. Amit Mehendiratta. I am practicing as a physician in Rewari, Haryana, India. So today I will discuss some important topic on hypertension. We have latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affect 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor of CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, their prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 50% of the men and 40% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide, according to WHO Lancet 2021. International Society of Hypertension has released the ISH 220 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor setting. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimal standard of care to allow specification of essential standards of care of low resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk with stage 1 hypertension, management start with non-pharmacological therapy. If blood pressure remain uncontrolled at 3 6 months, considering starting pharmacology therapy. Acute respiratory distress syndrome is potentially fatal condition involving lung damage. Experts often offers it with severe COVID-19. A recent study which appeared in the Journal of the American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 mmHg range substantially reduce severe adverse events in the STEP randomized trial, affirming the sprint finding for an older Chinese population. Among some 8,500 patients ages 60 to 18 China, the intensive target trimmed 26% of the composite severe risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which among US professional society range from threshold of 130 to 150 of mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on the office BP management but also on out of office BP measurements or home blood pressure monitoring. 24-hour and nighttime BP measurement were associated with greater risk of mortality and composite of CV outcome. Thus, they may be considered as the most relevant measurement of estimating CV risk. For every 20/10 of mercury increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial due fixed combination of ACE or ARB or CCB or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is detection of a non-carcinogenic namely NDMA, which can be found in candacetin, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified the WHO International Agency for Research on Cancer to carcinogenic in humans. If one like patient would have received NDMA contaminated valsartan from Zhejiang, Huai, every day of 4 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in one lakh patient if they had taken the highest daily dose over 4 years. World certain recall a campaign by significant increase in the risk of emergency department visit of plus 6%. The IGR study represents the largest study that tested nighttime antihypertensive treatment. In the trial, chronotherapy was associated with significant reduction in endpoints, including death. The IGR chronotherapy trial tested whether nighttime therapy in comparison to usual upon awaking hypertension therapy exert a favorable CV risk reduction. The study include a total of one 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome, and ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with awaking treatment. So, guys, thank you very much. Once again, Dr. Amit Mandiratta. Thank you and have a nice day.